For more than 130 years, the state of California has sought to treat, educate, and rehabilitate troubled youth in secure facilities using innovative treatment methods.
I started working with the youth, and I fell in love with the work. These were youth that could be difficult, but were witty, were incredibly smart, had backgrounds that broke my heart. I could see their desire just to connect with people. I could see their desire to have a good life. And I recognized that this moment, this facility, this work was their shot to turn it all around. And so I used to tell folks as I started getting more and more into this is what I want to do, you know, why would you want to work with that population? I really felt like they had fallen through so many other systems, that these were the kids that the world threw away, and someone needed to step up to care for them.
After June 2023, all state-operated juvenile facilities will have closed, and youth will be the responsibility of counties through a process called realignment.
To really help the youth become a healthy person, you have to take a very holistic approach. And we created a very all-encompassing, collaborative model that's very difficult to do in this type of environment.
While the need for youth programs was recognized when first California earned statehood in 1850, the first facilities solely for youth weren't authorized by the California legislature for another decade, with the founding of the San Francisco Industrial School in 1859. It was another 3 decades before the establishment of 2 reform schools, the Whittier State Reformatory in the south and the Preston School of Industry in the north. These institutions taught valuable trade skills like machinery and printing press operation. In the early 20th century, the Ventura School for Girls was opened. As the Great Depression of 1929 thrust millions out of work and into poverty, the first statewide probation office opened under the State Department of Social Welfare. And in 1942, as World War II was getting underway, the California Youth Authority, or CYA, was born. As the war ended, California opened conservation camps. The very first one, Pine Grove, is still in operation today. In the early 1960s, CYA, now a state department, had become part of the newly formed Youth and Adult Corrections Agency. CYA had a national reputation for innovation and forward thinking, but DJJ was becoming a victim of its own success.
As juvenile crime increased across the nation, things start to build in a different direction. If you consider that in 1972 or so, there was institutions was closing. For instance, Paso Robles facility closed in 1972, I believe, but reopened in 1974. And then as the 90s came on, the Get Tough on Crime laws were being passed. There was quotes, the youth were being identified as super predators, etc. And the population within the organization started to skyrocket.
By 1997, tough on crime policies ballooned the youth population to more than 10,000 youth in 11 separate facilities.
And so again, it put a unique challenge on the organization because again, staff were not prepared or did not have the resources to manage that population and provide the treatment and training that was necessary to guide their lives, help them get back on track.
The increased population and a move away from the vaunted therapeutic model towards a more punitive one created an atmosphere where custody and control rather than rehabilitative programs were primary. Former DJJ Director Rachel Rio said a burgeoning population combined with strategic budget cuts created a dangerous dynamic.
Some of the decisions that were made were to reduce the staffing on your general population units. These are your regular units, your regular kids, many of them who were gang-involved kids that did not meet the specialized treatment program, but still had a lot of needs. And so as those general population units decreased in staffing, what happened is those kids were sent to their rooms more often because there wasn't enough staff to do programming. And it wasn't safe for staff to do programming if there was just a smaller number.
As conditions deteriorated, a lawsuit was filed by a citizen against what is now known as DJJ, the Division of Juvenile Justice. The suit alleged that conditions were inhumane, and staff was accused of verbal, physical, and sexual abuse of wards. Several youth suicides created a public outcry, and a judge appointed a court master to oversee reforms.
I had an opportunity to visit some of the other facilities in Washington and Oregon where they were implementing evidence-based treatment programs.
In 2004, the court required corrective action plans for key portions of DJJ's operations, and an independent subject matter expert was appointed for each area. Safety and welfare, mental health, education, sexual behavior treatment, healthcare, dental services, and youth with disabilities. One of the most important reforms was the implementation of the Integrated Behavior Treatment Model, a comprehensive approach to assessing, understanding, and treating youth.
IBTM, to me, focused on making the youth relatable to staff. It wasn't like, you're over there, you're bad, and I'm good, and you deserve it. It's more like, hey, what's going on with this kid or this person? Regardless of what they are, you're always making an attempt, or staff are always making an attempt to address what this individual's issues are to put them on a path to this. The great thing about IBTM is it's just not the assigned counselors or the assigned COs. It's the involvement from the plan operations people that carry youth around as a trustee or a worker that are involved in IBTM that give positive reinforcement.
The approach helps to reduce institutional violence and the risk of future criminal behavior. Another success that came from Farrell was the development of the Sexual Behavior Treatment Program, which has proven effective in preventing future sexual harm behaviors in young people.
That changed that belief of, that using a model that doesn't work with this population, to getting interventions that specifically tie to the skills that need to be developed to reduce that risk that we've identified in that individual assessment, to working together as a team to have the same common language.
In 2016, the Alameda Court, satisfied that DJJ had complied with the remedial plans, released the division from court supervision.
No system's ever perfect. All systems can improve. Were there times that DJJ lost their way? Yeah, but I don't think that should be how DJJ is remembered.
DJJ, once a revered leader, but fallen to disgrace, was again a national model for youth offender treatment.
Those things really start to have a more structured, organized approach. And therefore, the interventions being utilized at the time had been surrounded with evidence-based interventions that had shown to reduce violence, risk to reoffend.
The population, at its mid-90s height, more than 10,000, had fallen to less than 700, allowing a greater staff-to-youth ratio and an improved focus on team-based, individualized treatment plans for each youth.
One of the main things I think we learned out of Farrell was if you're not tracking it, you're not doing it. It became very evident that you can tell somebody, well, we do make sure they earn their credits. We do make sure they go to school. But if we're not actually tracking it, it didn't happen. You have nothing to base that on. So I feel like when we had Farrell, it really made us track what we were doing and manage it much better.
Governor Gavin Newsom, in 2019, vowed to change the face of juvenile justice in California. Initially, DJJ was slated to move from corrections to the Health and Human Services Agency as its own department. But following new standards that urge placement and treatment of youth closer to their home communities, legislation was passed that realigns youth back to counties and called for the closure of DJJ facilities. An exception was the Pine Grove Youth Conservation Camp. That camp, nestled in the foothills of Northern California, has been training youth as wildland firefighters since 1945.
1, 2,
As the oldest continuously operating fire camp in the state, it will continue to serve youth and remain as a legacy of California's more than a century-long quest to treat and rehabilitate justice-involved youth.
We changed the whole system. When you look at class action lawsuits for prison-like environments, the amount of work that we were able to do in the time that we did it was amazing. I hope we're remembered for the mission that we're caring for kids, and that we did.
As DJJ closes, it leaves a 160-year legacy of efforts to treat and help youth change. As counties now pick up the mantle of youth treatment, evidence is beginning to show that the IBTM treatment model that DJJ pioneered is sound and an effective tool to help youth to achieve long-term change.